Oh, look who's here. Our favourite patient. So, how are you feeling? A little bit nervous? That's understandable. Alrighty, so we're just getting ready for you. Just going to pop my gloves on. You're lucky you're first of the day, aren't you? Because you wanted to be done quickly when I saw you earlier on the ward round. Well, you're in wonderfully capable hands here. And you're going to have a wonderful sleep, because I always ensure our patients have a wonderful sleep. I'm just going to double check over your notes now. Yes, I can talk you through things if that's what you'd like. We tend not to say too much to some people because they will get anxious, but if you want to know, I am more than happy to do this for you. Okay, they're all on. Let's see what we've got on the notes. Okay, just put that underneath. Right then, so let me just check your wristbands. Yep, that's you. Okay. Alright. So your checks this morning were all good, that's fine, we're all happy with that. You've got a healthy BMI, your blood pressure was stable. That's fine. I checked inside your throat, but I will do that again very soon. Okay. All right. Okay. That's perfect. Okay. Right. And you've signed the form, so that's good. So I can be let loose onto you. I'm just joking. You're going to be absolutely fine. Okay? Alrighty. So, you're a little bit anxious. Alright? Yeah? Okay. Well, what I want to do first is I just want to pop a little bit of cream . A little bit of cream onto the back of your hands, and this is where I'll be putting in the cannula. Okay, and this will just numb up the back of your hand. Okay, so let's just do that first. There we go, just a little bit like that. Okay, so let's have a look at this hand. Let me just spread that on there very gently. There we go. There. That's all good. Okay. So today I'm going to be doing a gas anaesthesia induction on you, okay? Which means that you're going to be breathing a mixture of gases through this mask, okay? And just like you asked for, this is a vanilla scented mask, okay? So, like a little smell of that. There we go, promised you. I keep my promises, don't I? So you chose vanilla, so do you like that? That's good, okay. So you're going to be breathing in some gases through that mask, okay? And that's going to send you off to sleep. All right? Okay, so I'm going to have a little look down your throat, if I may, okay? Just open nice and wide for me. Okay, that's perfect. Just going to shine this light in there. Just double check everything's still looking good. You've got no teeth or fillings that have come loose since this morning. I'm sure that wouldn't happen, but you never know. Okay. Alright, let's just have a look at the top. Alright, that's fine. Okay. So I'm going to have to connect you up to the monitor. Okay. So with this we monitor your heart, okay, your oxygen saturation, your blood pressure. Alright. And I'll have to just pop a few little leads onto your chest. Alright, okay. And then we'll get you all connected up so we can see what your baseline's like. Alright, and then when we start to do the anaesthesia induction, we can keep a close check on you there to see how you're doing. Alright. Okay, have you had ECG leads on before? You have, okay. Alright. So, I'm going to be popping these sticky pads onto your chest. Okay, just these. Okay. That one on there. There we go. That's good. Okay. And what this does, it allows us to keep a track of your heart rhythm. Okay. It's got one more to pop on. There we go. Perfect. Now I just have a few leads to pop on to those pads. Okay. Alright. This won't hurt you at all. Okay, so just going to clip this onto the pad and get you connected up. There we go. That's all good. Well done. You just relax while I just do this, okay? It's not painful at all. Okay? I want you to start thinking about nice things and taking some nice deep breaths, okay? Just so you're nice and relaxed. But of course you'll be very relaxed soon, because I'm going to give you something that will make you feel very, very relaxed. Okay, and one more there. Perfect. That's perfect. All good. Okay, so let's just check that there. Okay. I'm just going to pop this onto your finger. This is the pulse oximeter, okay? So just hold out that hand for me. There we go, let's just get that on there. Perfect. Okay. Alright. And I just need to pop a blood pressure cuff onto your arm too. I'm sure you've had one of these on your arm before. There we go. Let's get that nice and tight around your arm. There. You're doing great. Okay. Right. So let's just check that machine now. Okay. Right. Okay. Let's just see how this hand is doing. Okay. Can you feel this? Right. Okay. Sometimes we need to put a little bit more on. You can feel that a little bit? Oh, okay. Let's just put a little bit more on for you. There we go. Just a little bit. Okay. All right. Okay. The gas. Okay. Well, the anaesthetic gas I'll be using today is called sevoflurane, and although you've got the vanilla smell of the mask, you may smell the gas a little bit too. It smells a little bit like felt tip pen, slightly sweet smell. It's not at all irritating, it's not going to make you cough, it's not unpleasant at all. Okay, and that'll be used to give you the induction today and also to keep you under anaesthesia. Okay, yeah, with certain people we have to do the gas induction as opposed to the other method where we start to inject anaesthetic agents. Okay, but I will be putting a couple of drugs into your cannula, all right, before we give you the gas. Okay, and one of those is going to make you feel very, very relaxed before we start the induction. Okay, yeah, okay, so I'm glad you're up for that. Most people are. All right then. Okay, so let's just have a look at that hand again now. Don't feel silly about being nervous. It's very, very common. I would be nervous, and I do this for a living. There we go. Is that all right now? Okay, so let's just see how you're doing there. Your pulse is very good actually, it's not racing. Alright, your blood pressure's very healthy as well. That's coming in at 122 over 75, so that's fine. Okay, perfect. We like a nice healthy patient in that department. Alright, okay, so that's perfect. I'm going to pop you a cannula in. Alright, so just take some nice deep breaths, okay, and don't worry about this, you won't feel it now you've had the numbing cream on your hand. Alright, okay. Okay. So let's get that cannula in for you. Alright. Just going to use a wipe to cleanse the area. Now the cannula is a way of us getting drugs into your system. Okay. We just put them directly into the cannula and we can administer everything we need through there. Alright. And fluids as well. Alright, so let's just give this a wipe down now. Feels a bit cold, doesn't it? Yeah. There we go. Okay, so just going to get the cannula open. You want to see the cannula? Yeah, I can show you the cannula. Okay. You sure? Not everybody likes to see these things. Okay. Right, so there's the cannula. Okay. And that's the needle. No. Don't be put off by it, honestly. You're not going to feel this. Okay. Alright. So, what I need you to do is just take some nice deep breaths for me. Okay. I'm going to put this tourniquet just around your arm, just to bring up that vein for me. Okay, because it's going to go just here. So let's get that around there. Okay, and this is going to feel rather tight, I'm afraid. Sorry about that. Okay. Right, here we go. So nice deep breaths for me, just while I put this in place. Let's just check that vein. Yep, that's good. Okay. Deep breaths for me now. Thank you. Let's just get that in there. Okay, there we go. Well done. Doing really, really well. Right, let's take that tourniquet off. That feels better, doesn't it? Okay, now I just need to pop the dressing over the top to hold it in place. Okay, so let's just get that open. And let's just pop that over there. It's a special dressing that holds that nicely in place. Okay. Okay. Is that comfortable, that cannula? Great. Okay. That's looking wonderful. So how are you feeling? Good, good. Right, okay. Right, so you're absolutely happy with your vanilla mask. That's good. Okay. Perfect. Right. Okay. Just relax while I get a couple of things ready. Oh, this is a LMA, a Laryngeal mask Airway. This is what we administer the anaesthetic gases, okay, through into your body whilst your operation goes ahead. Okay, so you have a nice clear airway and everything goes through and you can breathe nice and well. Alright. I'll show it you. There we go. They look like a little mask just like the one that's going to go over your face, okay, over your nose. Alright, there we go. So it's just the mask and the tube, okay. I won't go into details as to how it all works. You don't need to know all that, but this is how you're going to breathe. Okay. I'm just going to check it all now, make sure it's the right size for what we're doing, and then my trusty technician can get that prepared. That's perfect. Okay, there we go. I'll get on with that. Right then. So what I'm going to do first, before I do anything else, is give you a little bit of medicine, okay? I'm just going to pop this into your cannula, alright? And this is going to make you feel very relaxed, a little bit floaty, alright? Okay, so that's what it is, just a little bit, okay? Just relax for me, let me just pop that in that cannula. There we go. So shut your monitors. Everything's going well there. Lovely. Okay. Perfect. Perfect. Okay. Just check all those leads are in place. Everything seems to be working well on there. We just have to check. Okay. Yeah, just check your notes. I think your surgery is only going to last about 20 minutes, so it's not a long one. So we'll soon have you out of here. Alright, all good. All good. There. How are you feeling? Starting to feel a little bit floaty in the head? Good, good. Don't worry, it's not scary. You'll just start to feel a little bit light and a little bit relaxed, okay? Just try and just breathe gently. There we go. That's perfect. Alright, okay. So what I want to do now is I'm just going to gently put this mask just over your nose and mouth, okay? And I'd like you just to breathe normally for me. This is just oxygen, okay? I want to get your body really lovely pre-oxygenated, so it's full of lovely, lovely oxygen, okay? For when we start the anaesthesia, we need you at peak oxygen levels in your system, alright? Okay, so just breathe normally. You'll smell the vanilla. There's nothing else coming through apart from oxygen. Alright, my love. Okay. There we go. Just pop that over there. Just breathe nice and steady for me. In. Out. In. Out. That's perfect. You're doing really well. Okay, really, really well there. Really, really well. Keep breathing for me. Okay, just oxygen, and you'll be able to smell that lovely vanilla scent. Okay, you doing all right under there? Doing okay? Good. There we go. Just a little bit more for me, my love. Thank you. Get all that lovely, lovely oxygen into your body before we start to help you drift off to sleep. Okay. That's lovely. you're looking really relaxed now, which is good. Okay, I'm just going to add a little more medicine into your cannula. All right, okay. There we go. Okay, that's perfect. All right then. So you're going to see me holding up this, okay? This is just to aid with any breathing whilst we give you the anaesthetic gases, okay? So that's all that is. Nothing to be worried about, it's perfectly normal. Okay, alright. Okay, so let's double check up there, everything's fine. So we're all ready to go. That's perfect, all ready to go there. Okay, so I'm now going to place the mask over you again, and this time I want you to take a big breath in before I do it, okay? Think about lovely things like your favourite place on holiday, which hopefully you can go to soon, alright? And just take nice deep breaths after that, okay? So big breath in now. Okay, I'm going to pop this over. There we go. And there we go. Alright, and just breathe for me. In and out for me. In and out for me. That's good. Nice steady breaths in and out. Think of those lovely places you like to go. As you start to feel very, very sleepy. Very, very sleepy. Very, very sleepy. Start to feel lighter and floaty, and your eyelids go really heavy. That's perfect. And I'll see you very, very soon, and you'll be in the best care. So, sweet dreams. Okay. Wake up, sleepyhead. Your operation's all over now, and we're going to get you into recovery. So, it's just me, the anaesthetist. Your surgery's all done now. Don't worry, you might not be able to see me so well just yet, but there we go. This is just oxygen, and we're going to get you into recovery and keep a good check on you. Your surgery went fine, okay? Everything fine. And I'll check on you a little bit later. Okay, so just close your eyes and rest a while. But everything's fine, and your surgery all went perfectly well. Okay, so I'll see you in a little while.